I'm actually
Okay na,
outside.
sir.
You can hear me, no? Klaro ba kayo? Sababay akong background. Okay, anyway, we'll answer the questions for the semifinals exam. So, okay, our test one is multiple choice, no? So, this is the first question. Tonsillar structures of the tonsils are also called. What's your answer for this one? A. Waldeyer's ring. We have the palatoglossal arc, the velum ring, or the palatine arc. Tonsillar, tonsillar structures of the tonsils are also called. The correct answer for this one is Waldeyer's ring. So that's letter A. No? We have number two, known as the heart's natural pacemaker. Anyone? Uh, anybody can answer this question. Known as the heart's natural pacemaker. His Purkinje network. We have the AV node. Letter C is the SA node. Letter D is apex. What's your answer for this one, Mr. Gores?
SA node, sir.
Okay, that's correct. That's SA node. We have number three, a condition in which the blood has low number of platelets.
Thrombocytopenia, sir.
Okay, A, thrombocythemia. We have thrombocytopenia. We have the Van Willebrand disease. Or letter D, we have thrombosis. And the last is letter E, which is none of the above. None of the above, sorry. Thrombocythemia, we have thrombocytopenia, Van Willebrand disease, thrombosis, or none of the above. Anyone?
Bravo, sir.
I'm sorry?
Thrombocytopenia, sir. Letter
The
B.
correct answer is thrombocytopenia. Yes, that's correct. So you have number four, a blood test used to get the number of platelets code. We have the blood enzyme test. We have the lipid panel, metabolic panel test, comprehensive metabolic panel. So the correct answer for this one is anybody? This is very popular or very familiar to you guys when you go to the laboratory. This is what we do, no, to check our the blood profile of the patient, and this is the CBC, the complete blood count. If you are familiar with that one, and that's the correct answer. So it's not here from the choices. No, so that's the answer is none of the above. The correct answer is complete blood count. So the medicine that prevents blood clot from forming. So we have thrombolytics, anticoagulants, we have catheter-directed thrombolytics, D, A, and C, or all of the above. The correct answer is anticoagulant. So that's a medicine or any drug or drugs or an agent, no, used to prevent blood clot from forming. So we have number six, surgical removal of clot is also called A, catheter-directed thrombolytics. We have coronary artery bypass grafting, endoscopic vein surgery, thrombectomy, foam sclerotherapy, or letter F, we have both A and C. Anybody? surgical removal of clot is thrombectomy. That's the correct answer. The rest of the surgical procedures are um, um, heart procedure no, sa catheterization unit. So the correct answer is thrombectomy. Number seven, lymphatic system is also called a complementary circulatory system, complementary immune system. You have lymphoid system, and both A and C, or all of the above. Anyone? That's correct. The answer is lymphoid system. So the following are the functions of lymphatic system: production of immune cells, catch pathogens from food and air, tissue drainage, fat transport, or none of the above. Okay, again, that's number eight. No, the following are the function of lymphatic system except production of immune cells, catch pathogens from food and air, tissue drainage, fat transport, or none of the above. So lymphatic system, one of the functions of lymphatic system, they produce immune cells, right? They also they also they're also fat transporter. So they also drain tissue. Yung mga ions, remember yung sa capillary, not all capillary are actually sealed. May mga leaks doon. So when there's a leak, sometimes they get those leaks, no, yung mga ions, nutrients, and then they they put it back again to the system for recirculation. So the correct answer for this one is catch pathogens from food and air. So they don't catch pathogens from food and air. So that's letter B. So number nine, the normal blood pressure is A 120 mmHg per 80 mmHg. What do you mean by mmHg, guys? I'm sorry. Okay, that's millimeter of mercury. So that's correct, no? So what's your answer for this one? 120 millimeter of mercury over 80 millimeter of mercury. We have 120 over 80, both A and B. 120 over 70 or 120 over 60 or all of the above. So the answer is 120 millimeter of
A,
mercury
sir. A.
over 80 millimeter of mercury. So letter A. That's the answer. Sorry for the background, guys. No, the following are causes of a hypertensive person except. So these are the the causes. No, the factors that causes hypertension to a person. So A, overweight, B, over 65 years old. We have C, drink too much alcohol or coffee. So person who smoke. No? Letter E, eats plenty of vitamin K food. F, none of the above. What's your answer? The answer is letter E, eats plenty of vitamin K food. So hindi siya na belong doon sa factors. Number 11, a small bean structure that is part of body's immune system is called spleen, lymph node, thymus, marrow, or none of the above.
Okay.
What's your answer? Lymph node. That's correct. Okay, number 12. These are small plastic patches that stick to the skin and are placed at certain spots on the chest, arms, and legs. What do you call them? A. Electrodes, anode, cathode, semiconductor, vacuum, both A and C, or all of the above. So the correct answer is electrodes. So these are small plastic patches that stick to the skin and are placed at certain spots on the chest, arms, and legs. Blood clotting is also known as embolus, thrombus, coagulation, A and B, or all of the above. So blood clotting also refers to coagulation. No? Letter C. So number 14, this refers to the pathway from which blood is confined to a closed system of blood vessels and to the four chambers of the heart. We have the pulmonary pathway, systemic circulation, circulatory pathway, or the vascular pathway. Anyone? The answer is vascular pathway. Okay, number 15, the pressure of blood pushing against the walls of your arteries. Blood pressure, BP, heart rate, both A and B, or all of the above. What's your answer? Okay, blood pressure or BP. So that's both A and B. So true or false? High blood pressure can damage your arteries by making them more elastic, which decreases the flow of blood and oxygen to your heart and leads to heart disease. What do you call? What's your answer? True or false? Anyone? Okay, the answer for this one is false. High blood pressure can damage your arteries by making them more elastic. This more elastic made the statement wrong. Less elastic. No. So number 17, chest pain is also called angina pectoris, stable angina, A and B, or all of the above. What's your answer? Angina, stable angina, and angina pectoris are all the same. So the answer is all of the above. Number 18, a condition that means your heart can't pump enough blood and oxygen to your organs. So usually ito yung mga problema na nasa ICU, no? If the heart cannot pump anymore, they don't it doesn't have the capability of um, pumping enough blood, no, and oxygen, and it will be distributed to the organs. So once na hindi na siya, wala siyang capability to pump blood, so that's what we call heart failure. So that's letter C. Number 19, the following is the internal structures of a lymph node except trabecula, hilum, medullary, sinus, follicle, none of the above. What's your answer for number 19? For number 19, anyone? Okay, these internal structures that I mentioned a while ago are actually part of the lymph node, the trabecula, hilum, medullary, sinus, follicle. So the answer is none of the above. So number 20, blank is a cancer that begins in infection-fighting cells of the immune system called lymphocytes. What do you call them? What kind of cancer is this? Anyone? Anybody? Okay, A, lymphedema, lymphoma, leukemia, both A and B, and none of the above. What's your answer? Okay, the answer is lymphoma. Yung lymphedema naman, yung nagsiswell yung legs natin, yung tissue ng legs natin or any part of the leg part na the thighs, yung nagkakause siya na accumulation ng protein. So, that's it. The answer is letter B. That's lymphoma. Okay, how does blood flow through the heart step by step? If you did a diagram for this one, I will consider. So from the oxygenated blood that goes to the heart through the two big veins, the inferior vena cava, which is responsible for the lower portion of our body, and the superior vena cava. So from there, pupunta siya sa um, right, right atrium. From right atrium, there's what they call a valve, no? Yung tricuspid valve. So from tricuspid valve, nagpa-pump siya, it goes again to the right ventricle. The from right ventricle goes to the pulmonary trunk, then pulmonary uh, arteries na siya yung nag-carry ng deoxygenated blood going to the lungs. Now from the lungs, there's what we call pulmonary veins that carries oxygenated blood to the heart. So from the lungs, pulmonary veins, it goes to the left atrium. So nagpa-pump na naman siya. Okay? So it pumps, it empties there. Then with the help of the bicuspid valve or the mitral valve, it goes to the left ventricle. So from the left ventricle, pupunta siya sa where? Aortic valve, no? So with the help of aortic valve, nag-open siya going to the aorta, and the aorta will be the one to is the last or the last part ng structure. Siya yung pinakamalaking artery, no? That is connected to the arteries of the body na nag-carry ng oxygenated blood that goes to the different parts of the body or organs. So that's it. And we have the enumerate the 13 structures of the heart and give it specific functions. It's 26 points. So the ones that I mentioned sa how does blood flow, no? Na diagram or yung structures involved doon are actually the structures that I need to see here sa enumeration and its function. So for the activity 4 post questions, those are I just want you to 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 restate what's your answer, no, sa activity nyo. So I think everybody will get a perfect score here. And that's it. So let's start with the respiratory system. Let's have a three pitch presenters. Can we do that now so that we still have 320 we still have 1 hour now before your class with Ma'am Patalinghog. So just continue, no, the pitch presentation. So presenter number one, go ahead please.
Hello, good afternoon guys. Makita na ang presentation.
Yeah, visible na siya, Miss Medina.
Okay, thank you, sir. So for this afternoon, we are going to discuss the overview of the respiratory system. So when people think of the respiratory system, they usually think of breathing, yet breathing is only one of the respiratory system's function. There is so much more. So the bodily cells require a constant supply of oxygen for the metabolic processes that are required to sustain life. The respiratory system assists our body in obtaining oxygen from the air so that our organs can function. It also removes waste gases from your blood or our blood, such as carbon dioxide. The respiratory system is made up of organs and other elements of your body or our body that are involved in breathing and exchanging oxygen and carbon dioxide. But what exactly does respiratory system do? So the respiratory system is a network of organs and tissues that helps in breathing. It consists of our airways, lungs, and blood vessels. The respiratory system also includes the muscles and that power our lungs. So those are the components that work together to transport oxygen throughout the body and remove waste gases such as carbon dioxide. The respiratory system works with the circulatory system to provide oxygen and remove metabolic waste products, as well as in regulating the pH of the blood. So, what does the respiratory system do aside from helping us breathe? So, the respiratory system serves various purposes. It adapts the temperature of the air to match our body temperature and moisturize it to the humidity level our body requires. It transports oxygen to our body cells, and when we exhale, waste gases such as carbon dioxide are removed from the body. So, what are the parts of the respiratory system? So, the respiratory system is made up of separate parts that all work together to allow us to breathe. There are numerous different components in each group of parts. So first, we have the airways. Our airways are responsible for transporting air to our lungs. Our airways are a complex system that contains the following components. First, we have the mouth and nose. It is where the opening that allows air to enter our respiratory system from outside of the body. Second, we have the sinuses. It is a hollow region between our skull's bone that assists regulate the temperature and humidity of the air we breathe in. So the trachea receives air from the mouth and nose through the pharynx. So the trachea is the passageway that connects our throat and lungs. Next, we have the bronchial tubes. These are tubes that link the bottom of the windpipe to each lung. And lastly, we have the lungs, which are the two organs that take oxygen from the air and transport it to our bloodstream. So muscles and bones also help in the movement of air into and out of our lungs. Our respiratory system's bones and muscles comprise of the following. So we have two. First, we have the ribs. These are the bones that encircle and protect your lungs and heart. Kumbaga, more siya og cage for the lungs. Next, we have the diaphragm. It is a muscle that helps our lungs pull in and push out air. So if we have the parts of transporting oxygen or inhaling oxygen, there are also parts for exhaling waste, such as carbon dioxide from our body. So when we exhale, your body transports carbon dioxide and other waste from our body. Other components that interact with the lungs and blood vessels are as follows. First, we have the alveoli. Alveoli are the tiny sacs in the lungs that exchange oxygen and carbon dioxide. So diri mahitabo ang exchanging sa oxygen and carbon dioxide. Next, we have the bronchioles. These are small bronchial tube branches that lead to the alveoli. So at the end of the bronchioles, na alveoli. Capillaries, these are blood veins found in the alveolar walls that transport oxygen and carbon dioxide. Lung lobes are the sections of the lungs with 3 in the right and 2 in the left, as you can see in the picture. Lastly, we have the pleura. These are thin sacs that surround each lung lobe and separate them from the chest wall. So mura siya og protection sa lungs. So the following are some of the other components of our respiratory system. We have cilia, which are the tiny hairs that move in a wave-like pattern to filter dust and other irritants from your airway. So marsyag ang hair na to sa tong nose nga mag-filter siya sa air na to i-breathe in. And lastly, we have the epiglottis. It is a tissue flap at the tracheal entry that shuts as you swallow, keeping food and liquids out of your airway. So if kaning epiglottis ma-inflame or infected, ibara niya ang ato ang gimbale mo tawag dili na maka-breathe if ma-inflame siya or infected. Lastly, we have the larynx, which is the voice box. It is a hollow organ that allows you to speak and generate sounds as air. So that's all for the overview of the respiratory system. Thank you.
Good afternoon, everyone. Madungog ra ko, no?
Yes, Mitch.
Thank you. Um, I am the next presenter and I will discuss the components of the respiratory system, specifically the first three, which is the the nose, the nasal cavity, and the paranasal sinuses. So first, let me discuss the nose. So, kanang our nose is part of our respiratory system. It allows air to enter our body, then filters debris and warms and moistens the air. Our nose gives us the sense of smell and helps shape our appearance. So, kaning external opening of the nose is called the nostrils or the anterior nares. So, the dividing partition between the nostrils is the nasal septum, which forms two nasal cavities, and each cavity is divided into three air passages: the superior, the middle, and the inferior concho. The concho passages lead to the passageway called the pharynx. Here, the ear is connected to the sinuses, the ears through the eustachian tubes, and even the eyes through the nasolacriminal duct. So, mao na siya ang anatomy of the nose. So, the hard bridge at the top of your nose, kana siyang sa, kanang hard siya kanang sa baba sa imong nose is, mao na siya ang bone. The hair and cilia, this is the tiny hair-like structure inside your nose, trap the dirt and the particles. Then they move those particles towards your nostrils, where they can be sneezed out or wiped away. Next is the lateral walls or the outer walls. The outer walls of your nose are made of cartilage and covered in skin. The nasal cavities. Your nose has two nasal cavities, hollow spaces where air flows in and out, and they are lined with mucous membranes. The nerve cells. These cells communicate with your brain to provide a sense of smell. Next is the nostrils or nares. These are the openings to the nasal cavities that are on the face. Septum. The septum is made of bone and firm cartilage. It turns down the center of your nose and separates the two nasal cavities. The sinuses. You have four pairs of sinuses. These air-filled pockets are connected to your nasal cavities. They produce the mucus that keeps your nose moist. And last is the turbinates or conchu. These are three pairs of turbinates located along the sides of both nasal cavities. These folds inside your nose help warm and moisten air after you breathe in and help with the nasal drainage. These are the functions of the nose. So it serves as an air passageway. It warms and moistens inhaled air. Its cilia and mucous membrane trap dust, pollen, bacteria, and foreign matter. It contains olfactory receptor, which smells odors, and lastly, it aids in phonation and the quality of voice. Next is the nasal cavity. The inside of the nose, including the bones, cartilage, and other tissue, blood cells, and nerves, all the way back to posteriorly to the nasopharynx, is called the nasal cavity. It is considered part of the upper respiratory tract due to its involvement in both inspiration and exhalation. So, kanang olfactory receptors are kanang located in the mucosa on the superior surface. Makita man ninyo sa slide and picture. So the rest of the cavity is lined with respiratory mucosa, which it moistens the air and traps incoming foreign particles. The lateral wall have projections called conchu, which increases the surface area and increases air turbulence within the nasal cavity. The nasal cavity is separated from the oral cavity by the palate, which is the anterior hard palate or the bone, and the posterior soft palate, which is the muscles. The most important functions of the nasal cavity including warming and humidifying the air as you breathe and acting as a barrier for the immune system to keep harmful microbes from entering the body. Next is the paranasal sinuses. Cavities within bone surrounding the nasal cavities are the frontal bone, which is makita niyo sa screen kanang dapit siya sa forehead na to. Tapos phenoid bone, kanang dapit siya na siya sa ears. Tapos ethmoid bone, kanang mura siya kanang sa sintido gani. Tapos dapit sa eyes. Tapos ang maxillary is kanang mura sa cheekbone siya dapit. So the function of the sinuses includes lightening the skull, humidifying and heating inhaled air, act as resonance chambers for speech, increasing the resonance of speech, and serving as crumple zone to protect vital structures in the event of facial trauma, produce mucus that drains in the nasal cavity. So that includes my report about the components of respiratory system, the nose, the nasal cavity, and the paranasal sinuses. Thank you so much for listening.
Yes, makita na.
Pleura. Uh, Nathaniel, excuse me, sorry. I just want, sorry for the interruption. Usik, the first presenter was Medina, right?
Yes, sir.
Ay, okay. So please check your cast forecast so that I can give you your grade directly.
Hi, sir.
Oh, okay, continue, Nathaniel. I think that's it for now. No, so we have three presenters. So just don't forget to attach your check your classwork now so that I can provide you your grades. Mr. Nathaniel, just go ahead and uh, check your classwork. Okay. See you guys next schedule, and then we'll continue our speech presentation. We just have two topics: the respiratory system and the digestive system before we will have our finals exam. And that's our pointers. I believe that our finals exam will be May 9, but that's on election day, so I think it will not be. They will change the schedule, no? Maybe that's May 10 siguro. So, iti-change siguro yung schedule because it was actually scheduled on May 9. So, 2 weeks from now, we'll finish our term uh, for this semester. So, see you on next schedule. Thank you so much for your participation. Thank you. You can leave the classroom now. Thank you.